And some of the states care about residents and some of them don't care at all. I mean, they could have gotten, many states could have gotten more Medicaid money earlier from the Affordable Care Act. They didn't even ask for it. They just don't care.
Hey y'all, this is Kosta, and today I'm here with my guest, Margaret Morganroth Gullette, resident scholar at the Women's Studies Research Center for Brandeis University. An author, essayist, and activist, her contributions to the field of cultural studies of age include 5 books, the latest of which is Ending Ageism, or How Not to Shoot Old People. Today we're talking about how to prevent the next American eldercide. For our audience unfamiliar with this topic, will you start by sharing your perspective on the term eldercide and the importance of addressing this issue?
Yes, thank you, Kosta. I'm going to start actually with a sentence from a major government report. U.S. nursing home care is ineffective, inefficient, inequitable, fragmented, and unsustainable. And that was the conclusion of a very thorough investigative report from the prestigious National Academy of Science, Engineering, and Medicine. The acronym is NASEM. Care under government auspices has also proven to be sometimes corrupt and lethal. And I believe that what happened in March of 2020 was that the government abandoned the 1.4 million people who were in nursing facilities around the United States in 15,400 thereabouts nursing facilities. So the meaning of eldercide is it's an unfamiliar word. It used to mean something like Lizzie Borden took an axe, hit her mother's wood wax. In parricide. But I think we need a different term. There are some other terms floating around. They're a little more, they're geronticide, centicide. I like eldercide. I think it sounds American. We know what elders are. We know what suicide is. We know what side means. Out of 1 million U.S. deaths, over 195,000 residents in nursing homes across the nation died of COVID. That's almost 1 in 5 Americans. So the total residents in 2019 were about 0.5% of the population. So that's just an extraordinary condensation of death in one place that the government is responsible for. And I argue in the next book, which is called American Eldercide, that they died prematurely, they died unnecessarily, and they died in the very locales where they ought to have been protected. And I believe that it was indifference rooted in ageism and ableism and a few other prejudices that I am going to describe. That indifference rooted in ageism and ableism killed these people before their time. And I think the reason is why they were underprotected is not hard. I'm going to read another quote. Undervalued lives tend to be left unprotected, and the more exposed to risk, the more highly valued lives. The young more than the old, the rich more than the poor, whites more than blacks, Americans more than foreigners, and relatives more than strangers. The residents had undervalued lives, and they were underprotected. And the reason is what I call compound ageism. Because if it's just age, you're not getting all the reason they would be underprotected. They're not just old. They're also, some of them, less able. About 70% of them are female. They are all of low income. In fact, we're talking about indigent people in most cases. They are small people. Some of them are cognitively impaired. Small means they don't look like they could protect themselves. And in fact, they are defenseless. Mm-hmm. And I think the word for that, for them as a group, have nothing else in common. I mean, They're all races. They're mostly white, but there are plenty of other races. They're of all sexualities. They're of all levels of ability. They're of all levels of cognitive ability. They are a heterogeneous group. But if you want to say one thing about them, it is that they are healthy.
I mean, you've written that the deaths of residents in long-term care facilities during the pandemic were not an inevitable biological catastrophe. Would you expand on the conditions and neglect that led to this tragedy? And the way that you put it is, I quote, abandonment.
Yes, I think that's true. There's one, we have to look at the stereotype about them. And I think the stereotype is that people who move into these quarters have nothing much to live for. People wouldn't want to move in themselves. So, of course, why would these people be there? They're just waiting to die. And it can't be helped. Old people die. The people die. There can't be help. So I think what the stereotype is that it's futile to help them. It's just futile. Now, that certainly wasn't true in 2020. In the spring of 2020, there were, I'll give one example first. There was a marvelous nursing home in Baltimore run by a Black minister in a Black neighborhood, very poor, very indigent, very many people disabled, and so on. He, in all of 2020, he had no cases and no death.
That's incredible.
It is, and it should not be. In fact, there were 437 homes out of 15,400, or the other 15,000. There were 437 that in that year had no deaths. Now, so how do you explain that? Well, one thing, a Reverend DeWitt got, he got interviewed, and he was marvelous in his interview. And they said, how did you know what to do? He said, well, as soon as President Trump said it was going to be over immediately, I locked down. Wise man.
Right.
And when you locked down, though, he didn't just lock them in. He got a cook for better food.
Yeah.
He made sure that the nursing aides could stay there at lunchtime so they didn't have to go out. He was paying them in such a way that they didn't have to take another job. He got more TV sets because he thought, my people are there to be bored. And he got an activities director, or he plumped up the role of the activities director. And this is crucial. We already had an infection preventionist on staff.
Oh, wow.
We had a nurse who knew how to keep, well, it would have been the flu in any previous year and other, viral infections. It could have been SARS in the previous decade. He knew how, she knew, they knew how to keep the residents safe. So my argument is all the residents could have been protected. Every single one of them. They could have had resources focused on them. And that's my point. They could have had.
I was gonna say, what a lot of people don't know, unless they're obviously working in the industry, there was a lot of funding that came about in 2020 with the CARES Act. And then President Biden also had a similar bipartisan legislation when he first got into office. I can't quite remember the name. But there was funding designed to be given to nursing facilities and to hospitals and to various other Medicaid and Medicare recipients in terms of like providers. And so, and obviously you had PPP and all these other buckets of money. And we did the exact same thing. Like, we increased our infectious disease protocols. We increased our overtime thresholds so that we could mitigate the changing of shifts. And so, if you had like one person taking care of one individual, then that was the person that would be taking care of that specific individual. We wouldn't be changing out site locations with staff. All of that was possible because of the additional funding that we received from the federal and state governments. So if this nursing home, let's just say that they already had all these things in place, but they just excelled even more at preventing the spread of COVID-19 and the other 400 homes. Why didn't the other nursing facilities use the money to follow suit when obviously that was the intent of the funds that they received from the federal government, in your opinion?
Well, I think there's if they're important to look at their times, the time slot. I mean, when they most needed to be saved was March, April, May, and June. So that's when the clusters began. They began dying in terrible clusters, and it turned out that they were 30% of the day, 40% of the day, 50% of the day. In some states, they were, in Massachusetts at one point, they were 66% of the day. So I think what I want to look at first, what I think people have to look at to get the narrative straight, is why the federal government did not then provide, or the states to that matter, but I think the federal government is guiltiest. They, what Trump did was, he said, we don't have PPE. It's the stockpile has been, and this is true. The stockpile had been allowed to dwindle, and it had not been refilled by any president. So it's not all on Trump. The previous presidents had also neglected the stockpile. Otherwise, he could have gone out right then for the nursing homes. Now, he would have had to prioritize the nursing homes instead of the hospitals. And that's not what happened. In many states, including in my state, the hospitals got prioritized. Now, that was wrong. I mean, I say this on the basis of having listened to many reformers who know what they're talking about. They could have saved the hospitals by keeping people from nursing homes out safe in their own spaces. And there's some, I just want to say there were 300 greenhouse facilities that did very, very well. The greenhouse facilities are these small places, and they have single occupancy rooms and bathrooms.
Oh, wow.
So that's extremely important, and it will be extremely important in the future if we can get it. And in the greenhouse facilities, I'm just going to read this. The median death rate per 100 residents was so low, it was statistically zero.
Oh, wow.
And in unionized workplaces, the mortality rate was lower than in those without worker union. And nonprofits, which are often run by religious groups, Lutherans, Catholics, Quakers, they also did much better. The ones that we finger are the for-profits. 70% of nursing homes are owned by for-profits. And it used to be that they were bought up by hedge funds. And hedge funds care about the bottom line. They don't care about the people, the resident. I like to call them residents. I mean, they're there. They're not there to die. They'd be in a hospice if they were there to die. They're there. It's a new living space. It's a new congregate living space. And if it's done right, it can be very pleasant. And it should be. It will be very pleasant. People should expect a minimum level of good service, good health. I mean, we know what the ideals are. Everybody in the business, you call it the industry, but everybody in the business knows what the ideals are. So I think there was a lot of negligence. This is the answer to your original question, Kosta. I think that there was negligence, that they didn't hire They didn't do what apparently you did. They didn't hire more people. Many of them did not have sick leave. They don't have paid sick leave. Many of the aides in these places are so underpaid that they have to work 2 and 3 jobs. They're part-time. They don't get benefit. They work 2 jobs. They carry COVID from one place to the other. I mean, they could have been protected themselves. I'm not blaming the aides. I'm blaming the operators, the management, the people who just said, I'm not sure what they said to themselves. I mean, it's hard to believe. We know what they say now. They blame the aide.
Right. Well, and I'd say, I would say that most likely, I'd say that most likely it was probably profit over people, and that was kind of the. If you look back now, hindsight being 2020, that's the only way to explain it. And I have to ask, do the issues permeating facilities' inability to act and protect their residents in 2020 and prior still persist today? But also, have we improved at all?
There isn't. Well, can I go back a little bit to a previous?
Of course. Of course.
Yeah, because we were talking about their frailty, but also about how they expected to live a longer time. There are centenarian in nursing home. And there was one centenarian, her name is Sophia Gulchel. She survived the flu of 2018, 2019, and she survived COVID.
Oh, wow.
These are people with resilience. They're not biologically helpful. That's sort of the end of that particular issue with them. So they didn't need to die. They were not all frail and susceptible, and most did not die. And that is an important statistic for people to remember. If you are out there, if you think that they're just waiting to die, let me tell you, over 80% of them got COVID, and did not die.
Amazing.
So, I mean, they're more vulnerable than some of us in the general population. That's certainly true. So, but now to get back to your other question, you want to talk about whether there's been improvement.
Well, and I also want to know if the problem persists today as well.
Oh, yeah. Oh, yes. I think all the problems persist. I mean, in fact, in some ways, they may be worse. I mean, one of the odd things that happened in the spring of 2020 is, and in some places it'll be better, but what happened in the spring of 2020, you're seeing all these clusters of deaths, right? So you'd say to yourself, well, my God, let's get out of this business. This is a terrible business. It's going to have a terrible reputation. But in fact, the large companies and some hedge funds started buying up nursing homes. That's an almost incredible fact, but
Why?
It's true. It was a real estate, they were going cheap. The people were selling cheap, and they were buying low, and they thought, look, particularly if these places had been well run,
mm-hmm.
they had a reputation. People were relatively safe. I mean, it is an industry, as you have called it. So, but that doesn't answer the larger question of where it's better and where it isn't. I mean, I think one of the problems with the business is that the government set it up wrong. It's a system that is a hybrid system. It's run out of a federal agency, the Centers for Medicare and Medicaid, but it's run by the states, 50 states and Washington, D.C. And some of the states care about residents, and some of them don't care at all. I mean, they could have gotten, many states could have gotten more Medicaid money earlier from the Affordable Care Act. They didn't even ask for it. Mm-hmm. They just don't care. And I think here now, you have to think about racism and xenophobia. You have to say states that have foreigners or in the legislature, a lot of races, they are going to care less about caring well for these people. And it's not, and also, I guess you have to say this. When you work at a legislature and it hasn't done any reform in 2022, and many of them did no reforms in 2022, you look at the delays and you look at the way things got shelved, and then you look at half-ordered measures that did go through, and you say to yourself, we're so obvious, falling into the ear of those legislators. And it is certainly true that the lobbyists, there's a trade association, it has lobbyists, it lobbies Congress, it lobbies in the states. It's really extremely wealthy, and they have, and they pour them out all the time. They don't admit that they have ways of hiding the money that they're getting from the government. So it could be that they're paying the CEOs a lot, or different entities, and different entities get different amounts of money. And so if you don't look at if you don't audit them, you don't know what they're doing at all. But when you do audit them, you often find that they have these ways of hiding pockets of money. And so they have, and then they go to the legislature and they pour them out. They say, we just need more money from the government. And I think that some of them may need help from the government, but I think what you want to do is audit them. Now in Massachusetts, that's my home state. Though I know more about Massachusetts than about a lot of other places. The Department of Public Health has not audited yet in 3 years.
But so if you know that the conditions are bad, and I think that it's pretty much common knowledge that the conditions in nursing facilities are close to horrendous. Obviously, there was 400 some odd facilities that maybe didn't experience deaths, and let's give them the benefit of the doubt and say that there was a couple thousand that did the right thing. But ultimately, there's, I don't know, 15,000 nursing homes, I think I saw you write down, or 13,000, right around there. So I'd say 80%, 75% are not doing the right thing. Now, we know that's the problem. In Massachusetts, your home state, have conditions improved since the 2020 pandemic?
Well, let me give one example of something that the government did right here. They said, we're going to have mandate two or well. Right? You almost never get a mandate. I mean, you look at the federal government, under Trump, they strongly recommended infection control.
Mm-hmm.
Strongly recommend is not a mandate. Recommending that you vaccinate your aides is a recommendation. It's not a mandate. But in Massachusetts, the government said, we are going to go for 2 in a room. That's not ideal. Everybody knows that the ideal is 1 to a room with their own bathroom. And that would have prevented a lot of infections, because if one person got sick, their roommate got sick. I mean, that was...
Right.
They put up shields in some places, they put up shields to keep it. Okay, so Massachusetts looks like it's doing right. And in fact, most of the nursing homes are going along with it. And they can do that in part because there are empty beds. And one of the reasons there are empty beds is because the people are avoiding nursing homes. They just don't want to go, and they are trying to find any kind of alternative. And some of the alternatives are not good. I mean, you can't move back into a house when you've sold it. You can't move in with your kids if everybody is working and there are young children and you're not capable of caring for the young children. I mean, but at any rate, most of the nursing homes did act correctly. But about 26 of them sued the state and said, nope, we can't do it. So this is going through the courts. Now, I hope that the court will say it's a Department of Public Health mandate. It's crucial for human dignity and health that this be honored. So that's one way we did get it right. The new governor who's coming in, she has shown some interest in. She just got inaugurated a few days ago, actually. She's shown some interest in nursing homes. She's levying the heavier fines, but everybody believes that the fines are just a tap on the wrist. That you're not really charging them what you should. Charge them when they have abused a patient or killed a patient with neglect. So I think there's a lot of work to be done by the Attorney General and by the governor. And, we're just, I belong to a wonderful group. It's called Dignity Alliance Massachusetts. And it got started immediately in 2020 when I became so agitated about what was going on in this, and the deaths were just rising. All these people who had been in reform movements around the state for 20 and 30 years, and they were anti-ageist, they were pro-aging activists, they were disability people. They came in, they're lawyers and doctors and nurses and people who had been in Alzheimer's units, and they know what they're talking about. And I love them. And they sponsored bills in the legislature. So if you want to know where we are in Massachusetts now, is we're waiting for the next legislature to do it right with a new governor who may, lash the whip a little bit more over the legislature. We may get a lot more. I mean, there are agencies, there are groups, organizations all over the country now who are very exercised. I mean, some of them are the children of the lost residents, and never forget.
Of course not.
They were locked out. They didn't see their parents or their brothers and sisters, nieces and nephews. They didn't see them die. They didn't hold their hands. The suffering was excruciating.
Yeah.
And they are not going to forget. Now, the question is whether you can bring these people who have experienced this suffering and know the urgency of these, it's total transformation that is needed. If you can bring them together with the legislators around the country, that's what's needed. And it is total reform.
I have a lot of rabbit holes that we can go down. But, I think as we're talking about transformational change with regards to essentially the nursing home business, and I know a lot of it is underpinned by federal and state policy. The reason why I don't have a lot of confidence in it is because, if we can't pass gun control after however many school shootings, how in the world are we going to get legislatures mobilized to pass a nursing home reform act like they did in the 80s again in the 2020s?
We don't have we don't have a gun lobby. I mean, I think you can discredit the lobbies in the states and at the federal level. I mean, I think it is a powerful lobby, depending upon who runs Health and Human Services in Washington and who is in the state legislatures and the governors. I think certainly with this data, this mortality data, and this level of suffering, and these million or more people who are relatives and want this to happen, I think something may happen. But there is something else. There's another direction we should go in Kosta. A lot of people don't want to be in nursing homes, and we need to, and Dignity Alliance Massachusetts recognizes that deinstitutionalization is one of the ways that we could go. We could have far fewer than 1.4 million people. I mean, estimates vary, but certainly a third to a half of them could be living in assisted housing.
Sure.
And there is a program. There's a government program, and we got some of it in Massachusetts, and we may get it again. And it's called Money Follows the Person. And it means if you have, it looks like know something about it.
I do.
It looks that if you are indigent and partially disabled or have cognitive impairments or have mental impairments, there are many ways that you can use the money. Now, if you have to find housing.
Correct.
Now, I mean, somebody has to help you find housing.
Well,
and Money Follows the Person, for a while, actually, when it was functioning here, it helped people find the housing. But I think we need this kind of housing, specialized housing for this population. And that is a whole other, problematic in which you get developers involved.
Right. Well, and it's a three-pronged problem with regards to MFP and Money Follows the Person. Number one, it's the affordable housing problem. Number two, it's states that didn't expand Medicaid. There's very small percentage of people who qualify for that program. But the third one, and I think the one that's probably the most significant, is the fact that Money Follows the Person is a Medicaid-specific program, and Medicare, which is available to everyone over the age of 65, does not participate to the same capacity. And at the same time, because we're trying to, I want to pivot just a little bit backwards, because we're trying to affect 50 different state legislatures, whenever we talk about Medicaid, we could just very simply have Medicare pay for long-term care, and then there's actual federal governance over what long-term care looks like. Because when you're trying to create a standard of practice around 50 different states and their own practices, it's very hard to create benchmarks, measurable benchmarks for quality of care outcomes. But the federal government doesn't want to pay for long-term care, or they would have by now. So obviously,
well, they're not. It's not impossible. I mean, I hear everything you're saying, and it came up, as a matter of fact, in the Affordable Care Act. It was part of the Affordable Care Act. And you just have to explain to people who don't know anything about these programs that you pay into them over the course of your life, or, you start paying into them. They are a bit like Social Security. You pay your quarters and you get Social Security at a certain point in your life. Well, long-term care insurance can run like that. And it was in the Affordable Care Act. But this is under Obama. He had a Republican
legislature,
part Congress, that didn't want to do it. They said it wouldn't pay for itself, but it would have paid for itself. You don't vest immediately. It would eventually have paid for itself. And if you have not had, it could still happen. It couldn't happen now. It can't happen in 2023. But we have an election coming up.
Sure.
And what I'm hoping is that these agencies, these organizations, and there isn't a movement yet, but there could be. And it could be a movement for more affordable care coming out of the federal government. And it would be money that you could spend. It would be your money once you are vested. What I would like to tell you about, you know this already, but your viewers don't, probably. Washington State has it.
Yep.
It's going to start this spring, and it's going to be very interesting. It will take 3 years to vest. It won't give you, and I know the guy who runs it, so if you haven't had him on...
Oh, we'd love to have him on.
I think I'll give him your name.
Okay.
I'll give you his name, and you could get in touch with him. It will be interesting to see. People start putting their money in this spring, and so it will be 3 years
I
before
think
they're best. It won't be a whole lot of money.
It's a 2% payroll tax, if I'm not mistaken, right? A 2% payroll tax with a business match, or maybe a 1% payroll tax and 1% match.
I think it's lower than that.
Okay.
I think it's the 67 cents sticks in my mind. But for 100, would it be? But I'm not sure. Sorry.
Okay. So let me ask you this:
will know,
what impact did the lack of representation in the voices and experiences of residents have on the media coverage of Eldercide and subsequently our collective perspective?
The media was pretty bad. I had an intern, and she was reading a Google alert that I had set up for residents, nursing homes interviews. So I was trying to get quotations from the people themselves who were either, who were suffering and enduring, or who felt safe. It didn't matter to me. I just wanted to hear their voices. I wanted them to be represented. And she read 1,500 articles, and I read a couple of hundred more. And viewers, how many of those articles quoting residents? Well, you could get
10?
20.
20. Wow.
Okay, so I'm grateful for all those reporters for doing a very good job. And I use those interviews, as many of them as I could get into the book, in American Eldercide, because they're wonderfully rich interviews. I mean, they're like people like Sylvia Goldschall, who survived, and others survived. Well, I mean, they had to survive, didn't they? Or they couldn't have been interviewed. But they're just a marvelous set of people. So I think it's sad that they weren't considered to be witnesses, tested, to be able to give authentic testament, because when they were able to do it, they did it. And nobody thought of asking them. I mean, that's just the simplest question in the world. Nobody thought of asking them. But you can't. So you blame the media. Okay, fine. I mean, there are various ways where journalists out there who are interested in old people, but there are fewer of them than there used to be. That's just the way, newspapers are disappearing. Some TV shows were very good, actually. That's where I got to see a lot of residents on when they were interviewed on, little TV shows in little quote cities and towns. They seemed to be able to find them. So not many of them, but still, it was doable.
But what about like the major syndicated networks? Do they, they obviously know what people will and won't watch. So I guess the question is aside from sensationalizing the deaths that happened in Kirkland and in Washington State, and obviously the significance around the deaths that occurred in New York City nursing and New York State's nursing homes, no one really went, like you were saying, and talked to the residents to hear their stories as they are essentially navigating the front lines of a major pandemic. They did with hospitals, but long-term care facilities are like, and you said it perfectly in the article. You said they're warehouses for old people. And I paraphrase that, of course, but the term that I want to extrapolate from that is warehousing. Out of sight, out of mind. It's quite.
No, I think you're you hit on something else that I would like to emphasize, and that is the media think they know what people want to hear about, and I think and that's why the mortality statistics were so sensationalized. They were counted. They weren't hidden. But we have to look at the American populace as, I don't want to say guilty, although in some sense guilty yet. I mean, you have to think back to 2020, how terrifying a time it was, how covering clothes people got. If I think they would have liked to hear more voices of residents. I wouldn't say that they were indifferent to that degree. But I think what you have to look at is a difference before COVID and now. And I think what we are facing now is another fall into, they're not really human. I mean,
you think we still have that sentiment?
Well, I said, I use the word futility. I think what we need to fight, those of us who are the reformers, including you, what we need to fight is the idea that it's futile to rescue these indigent old women. I mean, I think it was easy for Trump to do it if he's a beleaguered soul. I mean, it's attached to the cult of youth, his own youth. He couldn't imagine rescuing those people. Now, so in part, we need to overcome this compound ageism in our own head. We need the imagination to recognize that they are human, and all the things that I said, we will be there. I mean, that's the other argument that people use all the time. You have to think, and it's very hard to think that you will be old and needy, right? Maybe it's easier to think that you'll be old, but not that you'll be old and needy. And yet, people over 65 are going to be about 3% of the population. And about 70% of them at that age are going to need long-term care of some form. It may be in the family. It may be somebody follows a perfect person. It may have to be institutionalized care. So we can't forget any of those options. We have, and many people of those 70% that will need something won't be able to afford it, whatever it is. So I think we have you have a population out there that's watching your show, and and maybe there's not much else.
It is hard to find topics and shows specific to long-term care, even though it's like you were just saying, 70% of people over the age of 65. But I'll tell you this, people over the age of 75, it goes up to 80%. I know it's a negligible statistic, but it's still 10%. So instead of 7 out of 10, it's 8 out of 10 people are going to need access to some form of long-term care. The baby boomer generation, born between 1946 and 1964, the first person that was born in 1946 has turned 75 now. I mean, obviously, the first person that's still alive has turned 75 in 2021, which means that we are now on this 8 out of 10, not precipice, but process. And so every year, more and more people are going to need access to these services. Now, my question is, and this is something that I pose to a lot of people, if Medicare and Social Security are two mandatory spending line items in the federal budget, and they're the two largest line items in the federal budget, how do you navigate the conversation to say there is a necessity for expanding long-term care to Medicare? It's a responsibility and a duty when we're already fighting about spending cuts now and not willing to increase funding for those two items. Instead, we want to do the opposite. How do you say, well, no, we need to spend even more money now?
Yeah. Well, you really need a political scientist who has experience with the kind of rhetoric that you use for Congress. But Biden put nursing home into the State of the Union address.
Yeah.
That was serious. That had never happened before. And I think a lot of people were heartened by that. Now, he didn't get the Congress he wanted. So it may be that we're going to have another 2 years in which it's harder to make these arguments, all the arguments that I have made and that you already know. But it's not even impossible now, because there are Republicans have relatives too in nursing homes,
right,
and they themselves sometimes wind up in nursing homes. And there are some parts of the legislation that they might like. I mean, you break down the legislation, and it's it's more money for AIDS, and it's one person to a role, man. It's more a government oversight, and it's more, some things so fines for the industry. No, probably not. Higher fines, but
you're saying just the sheer size of the population that'll be accessing long-term care will have to move the government in a direction where they have to act? No?
Not saying that, because I think we fooled ourselves too long with the idea that the boomers, just by their weight of their numbers, were going to change culture. They haven't changed culture. I mean, one of my books, actually, there's another book of mine that I want to mention, because it is my latest is actually called Ending Ageism, or How Not to Shoot Old People. How Not to Shoot Old People. It came out in 2017, and I didn't know that, in effect, in 3 years, in March of 2020, we would basically start hot shots at old people nursing home. No, I think the boomers have not changed ageism. I think many of them are trying. I think the Xers are going to move into that time of life in which they also are thinking, can we do something about ageism? Because now, of course, it's also a job problem. It's a work discrimination. And it's not getting better. It's getting worse. And we're seeing that, I think, in people over 50 who are unable to find jobs after they lose them in the pandemic recession. So I think there's I'm not very sanguine, but I'm not going to lose hope about any aspect of our culture where there might be an entry point for transformational change.
So how can we ensure, moving forward, that all residents, regardless of race or socioeconomic status, have access to quality care in congregate living facilities?
Well, that's everything we've talked about. We can't guarantee it until we have long-term care insurance, along with Medicare for all. Something, in other words, we can't guarantee. We can't guarantee it for the indigent, so we certainly can't guarantee it for the middle class. I mean, I think one of the things that middle class people don't realize is the spend down. I mean, we go into a nursing home, and it turns out that Medicare will pay for you for 3 months. And then after that, if you still need to be there, you are spending down whatever assets you have. And that's why people lose their homes. And I followed a middle-class woman who was a dear friend of my mother's, and watched her. I had watched her since my childhood. and something, to abbreviate a whole complex story, he said, I never thought I would wind up in a nursing home. He had owned her own house, and she was married, and she had 2 children. But so it happened. I mean, I don't, and you don't just want to scare people into caring about themselves.
But I mean, fear is an important tool. Probably one of the most important to cultivate change. I know that may sound dark and cynical, but I believe that one of the main reasons why we're going to see significant change in the coming years is not just the size of the group of people that need long-term care, access to long-term care and scale, but it's because those Gen X populations that are having to care for their family members, and they're also in poorer health than their family members were at the time that they're in their 50s, obviously relative to other populations like millennials and Gen Z. They may require access to long-term care even sooner than 65, depending on conditions like obesity and diabetes and things like that. And so I think that telling people that they should be scared because the system's not set up for you to be properly cared for is a very important tool to changing the narrative and setting us up for success instead of what seems to be at this point dire failure.
Yeah. I mean, I think we need all these rhetorics. Mm-hmm. I think we need to talk up the sensational data, with the caveats that I have put into it.
Of course.
That these people did not need to die, but I think you don't want to convince people that you can prevent another pandemic, and this will affect them. So, I mean, I think my book, American Eldercide, tries to do a whole range of tugs on mind and heart.
Absolutely.
And I think what I'm hoping for is it's called Herzenbildung in German. It's the expansion of the heart. So in expanding the heart, maybe you need a little fear, but you also need a lot of love.
Absolutely. You're right. Margaret, what tools can we use to address the underlying societal attitudes and stereotypes that led to the neglect and mistreatment of older adults during the pandemic?
Yeah, we've said some part of this. I think you have to work on your own anti-ageism and your anti-ableism, and also on your own fascism. I mean, this may be the hardest in the United States, because we are trained in an ideology of independence, and everybody's supposed to stand on their own 2 feet and pull up their own bootstraps and save their own money, and and succeed and save and be independent all their life. And this is less and less plausible in the United States. I mean, we have a capitalist system that is bringing greater inequality. So, how to fight classism is a whole other subject.
Sure.
But we start, I think, defining the problem, which a lot of political scientists and religious people have done. A lot of socialists. There's a good deal more validity to socialism these days. The young people seem to like the term. They like what they know about the project, the programs that it inspires and would work for. And then we also have to fight what I call dementism. I think this has 2 parts. One is the belief that people in nursing homes are all cognitively impaired or have some kind of mental defect. It's not true empirically, but there is a range of cognitive impairments in nursing homes. There's no doubt about that. So, how do you overcome dementia? Well, when the facts help a little bit. There's a whole range. We need to talk about the cognitive impairment on a spectrum, the way we have learned how to talk about autism. And I think we need to just stick with the people we know who begin to be cognitively impaired. And
yes,
and be good, talk to them, figure out how to talk to them. For a long time, they're going to be conversible. Probably, many of them will die before they stop being conversible. I just think there's a whole world of dementia experts. I don't like to use the word dementia, but they use it, dementia experts. And they have been telling us for decades how much better we could deal with this population, which of course is people all around us, not people in nursing homes.
And I mean, if you consider how many people go into a long-term care facility, whether it's a nursing home or some other type of facility, and they're prescribed opioids and antipsychotic meds, and people that aren't familiar with their background, that don't see them daily, may consider them to have some type of cognitive impairment because they're under the influence of hard drugs,
Yeah,
And so, and I'll tell you, the statistics that I've come across is that Medicaid recipients that are elderly, so Medicaid long-term care recipients, receive opioids in the 80% range, some type of pain medication that has a psychoactive effect to the pain relief. And if you consider those statistics, how could you not, if you're under the influence of such significant drugs, have the perception that you have a cognitive impairment? There's all these chicken and eggs that we're not connecting the dots on, and we're building an industry with bad information.
We're letting the industry get away with a lot of bad behavior. That's for sure.
That's a good point.
In Massachusetts, we're about a quarter of the people in nursing homes get antipsychotic. That is one of the highest statistics in the nation.
It's insane.
People don't all need antipsychotic. And if we could get them deinstitutionalized, they would not probably get prescribed antipsychotics to that degree, or
Correct.
The opioid that you're describing. We always we could go on and on with the people who are guilty. Medical directors. That's a whole layer of responsibility that I rarely hear anybody talking about. Every nursing home is supposed to have a medical director, but in many claims, the medical director is going to be overseeing who knows how many residences and how many residents. It's impossible to understaff at that level to that percent and not realize that things are going to go wrong, and that that there are nursing directors too. That there's just there's a lot of malfeasance in the system. And so when we talk about, we're really talking about two different things, I think, at this particular point, or we have been talking about two different things all day. One is popular stereotypes, misinformation, indifference, real evasion, actually, if you want aversion with these people. But we're also talking about the people who are responsible for them in the government and why they are not doing their job. That we've been talking about from the beginning in terms of the lack of PPE and the lack of inspections. it's a whole section of my book. We haven't even touched on it. So I think there is an awful lot to do. And I think what we've done, and maybe at some length, is we've at least named the problem. And I think that's extremely important, that your viewers know much more at the end of this session than they knew beforehand about the problem.
Well,
and they know one thing that is clear. They can change their mind. Oh, they are able to. Herzen, Bildung, up to here. If they cannot change the institutions, then we won't get the change that we will need.
And I'll tell you, it take us about an hour to identify the problem, and so it would take us many more hours for the rest of the conversation. And so maybe we'll turn this into a 4 or 5 part discussion. But Margaret, we always like to end the show with a call to action. What steps can individuals, families, and communities take to advocate for better care of elders in long-term care facilities and beyond to prevent the next American eldercide?
Yeah, well, we need an hour for that too. So I'm just going to say a few little things.
Sure.
What is, for people who like to be activists, there's certainly plenty to do. You can go to a nursing, you can bring snacks, and you can be a visitor to somebody. You can be an ombudsman.
Yep.
Every state has an ombudsman program. Now, some states it's run better than other states. The ombudsman is a person who goes into a nursing home and is without a warning, which is very important.
Mm-hmm.
A person can look at anything, can look at records, but also can look at, commonly, and look at the kitchen, and look at the nursing station, can come in at a shift change to see how many people are actually there when the owner says X are supposed to be there, and it's X minus 17.
Yeah.
I love that program. And some of the people I quote are actually, there are states that have programs in nursing home in which you get training to be a friend. They have different names, but you are sort of like an inside observer.
Sure. And
you have a credential from the training that you have been given. I think more states should have that. The other thing is, I would support nonprofits that are doing this work. In Massachusetts, I would say Dignity Alliance Massachusetts, it just became, they have had no money at all. Everything is for volunteer, and they have done amazing things. But now they suddenly, just recently rather, became a 501c3. So you can give them a little money, and they'll use it wisely. They do. They need a little research,
Of course.
But for national organizations, Justice in Ageism is one of the best. I like them a lot because they're lawyers. And I think for many of these fights, you must fill the law. You must get the attorneys general involved. You must hold Justice in Aging holds government agencies' feet to the fire. And you can look around in your state for the disability organizations that seem to be doing good work. Massachusetts, again, has a number of these agencies, and they are now, their leaders are incorporated into the Dignity Alliance Massachusetts. So I know when we sponsor legislation, we're not just looking at one population. We're looking at a lot of overlapping population. And they can be served. If you add housing, requires assistance, you're adding it for a whole bunch of population that could benefit from that. So So that's my advice. Get out, do something. Ah, yes, with where the thing. That was maybe too activist for some people. Start off with writing a letter to the editor. Whenever something comes up about nursing homes and you now know enough to say, well, really, write a letter to the editor. If you're even more ambitious, write an op-ed to your paper. There's a lot of local papers. Well, this is interesting, actually. This is another hopeful find. The papers really want anti-ageism material. They're really willing to publish it. The editors are looking for it, and if you write pithily and with a little knowledge and maybe drop in a statistic, show a little passion, you're probably going to get published. And of course, it's all to the good. It's part of the mission.